3 tips during this video to start integrating into your daily routine if you have ever been diagnosed with endometriosis. Now, if you have, or you assume you have endometriosis, but you haven't had the exploratory surgery, the laparoscopic surgery to determine if you actually have endometrial adhesions outside of your uterus, which is the definition of endometriosis, then, and if you haven't had that, but you assume you have endometriosis, these tips will absolutely help for you as well. Now, you have to understand that endometrial tissue that migrates outside the uterus and or endometrial-like tissue that is just embedded outside the uterus is what is the definition of endometriosis, meaning that you can have bloating, constipation, painful intercourse, low back pain, hip pain, or an array of symptoms that you can check out in my other videos about endometriosis. But today I want to focus on giving you 3 tips that can help you start to tackle your endometrial pain today, and also can help change your experience of how you're experiencing your periods, whether those are excruciating or not. This type of movement that we're going to go through can help you during your actual period itself. So, start to incorporate these 3 exercises into your routine, and I think you're going to find significant improvement in your endometriosis experience and help manage some of these symptoms. I do just want to side note that we have an amazing technology that we're using in our clinic that is actually very cutting edge. It is called shockwave therapy, and we're using that type of therapy to help dissolve the endometrial adhesions and scar tissue through the abdominal wall, and we are finding amazing success in helping people mitigate their endometrial pain and the pain that they have from endometriosis, and also just bloating in general too. So what I'm going to go through are these 3 exercises. Follow along, and I hope you enjoy them. Please ask me questions in the chat below if you have them. The very first thing we're going to do is called a colon massage. We are going to do this colon massage in order to help move our colon. And when we move our colon around, it can help move our other organs in our belly. And so this is a great thing to do in order to help not just get regular bowel movements, but to help decrease some of the strain that can happen when there's endometrial adhesions within the viscera, so on some of the organs, or embedded into the fascia, the endopelvic fascia, or just the peritoneal fascia. So do this work with me, and you will find hopefully improvement in your endometrial symptoms. Okay, so we lay on our backs. You can have your legs bent and or supported on a bolster, and or pillows work as well. You're going to take your 2 hands, put them on top of each other on the bottom right side of your belly, and you're going to go move your hands in a circular pattern, starting at your cecum, it's called, and moving up and around your colon, all the way around. This is a colon massage, and this is so good if you have endometriosis. Just start rubbing your colon. Now, if you don't feel like you can touch it because it's so sensitive, that's okay too. Just rub it very gently and start to get the tissue, feel that one there. Start to get the tissue sensitized to the actual pressure and movement itself. So you just work your hands around in a circular pattern, starting on the bottom right hand side of your belly, working up the right side, underneath your rib cage, across the rib cage, on the bottom of the rib cage, but you're on the transverse colon, and then you're going down through the descending colon and into the sigmoid colon, and you're just following the colon here. I'm going to show you a picture in this video so you can see what the colon massage looks like in your pattern, moving from the right side of your body and up, over and across, down the left side of your body, so you can visualize and see that. Okay, that was the colon massage. You should be doing that every single day for 5 minutes a day, and that will help get your belly moving and help get the organs moving, even though there's endometrial adhesions on or around those organs. The next thing you want to do is called diaphragmatic pelvic floor opening breathing. And the reason we want to incorporate diaphragmatic pelvic floor opening breathing is because we want to use our diaphragm to help move the organs and open the pelvic floor, which is going to stretch out the tissue where the adhesions are embedded. And it's also going to help open the blood flow and bring more blood flow to these tissues, allowing healing to happen. So you can place one hand on your belly and one hand on your chest. You're going to take a deep breath into the hand on your belly. So we're going to take a deep breath here and exhale and let it go. And notice how the hand on my chest is not moving too much. We want all the air to go into the hand on the belly. So deep breath in again. And exhale and let it go. Now on this next inhale, I'm going to have you focus down into your anus and into your vagina. As you inhale into your belly, I want you to think about opening into the anus, opening into the vagina. Exhale. There's a closure that happens. You're not doing a Kegel. There's just a simple closure. Inhale and open. And exhale. There's a closure. So the diaphragm is opening the pelvic floor. You're not forcing the air any direction. You're allowing the air to just fill the cavity that's there. You do not want to push or force any air anywhere. You're simply just inhaling and opening. A hip opener. Why are we going to do a hip opener if you have endometriosis? Well, depending on where your adhesions are, anytime that we have tension in our belly, which the adhesions cause tension where our bellies will wind up around those adhesions, causing pain, causing bloating. And so we need to help open up everything that's attached to those adhesions. So I could give you a whole list of exercises, but one of the best exercises is this hip opener that's simple and easy and you can do within your own home. So you just cross your leg like this in a seated position, sitting up really, really tall. And you're simply just going to sit here. I'm not putting pressure down on the knee. I'm just simply resting my hand, and then I will hinge forward, keeping my spine completely long, and I will just hold this for 60 seconds to 2 minutes. And as I'm here, you can do a double whammy. You can do a nice deep pelvic floor opening breath in this position, and exhale and let it go. And get even more opening throughout the entire pelvis. Once you do one side, you want to do the other side as well. And again, you should feel this nice and deep into the hip. You might not feel it in the areas that you have pain or bloating in the belly and or in the pelvis itself, but this is going to help open the pelvis. It's going to help open your hips and improve the blood flow all the way down to your pelvic organs. So incorporate this seated piriformis stretch today, and you will find yourself helping your endometriosis symptoms. I'm Dr. Allison Felt. Thank you so much for joining me today. I hope you got some insight into what's available for you as far as endometriosis. I hope you got some insight into what's available for you as far as dealing with your endometriosis symptoms. There is nothing worse than going to doctor after doctor after doctor and getting really grim news that you either need to get a clean out and get the excisions done, or you end up having to get you opt for a hysterectomy, and or you're on medications that you don't want to be on. So I want to tell you that there are natural options. You can reach out to our clinic, even if you're not located in Washington, and we can set up an intensive program for you to fly here and come and get treatment for a week. So we have had amazing success with that, and I would love to be able to help you. But in the meantime, before you do any of that stuff, please start integrating these 3 simple tools into your routine, and they should at least give you some kind of relief. I'm Dr. Allison Felt. Thanks for joining me. Take care.